All right. Well, good day, everyone. I want to welcome and also thank you for attending one of our PrimePay's regular monthly broker webinars. Today's webinar is entitled HRA Strategies, excuse me, providing a solution to rising employer and employee cost. Good day, everybody. My name is Steve Jackson. I'm the Senior Vice President of Strategic Development and Channel Sales here at PrimePay. And I want to personally welcome you, but also thank you for taking time out of, well, you know, one of your busiest times of the year, right, to sit with us today. So we truly are grateful and appreciate that here today. It means a lot to see as many of you on here today, as busy as you are, to at least take this next 45 minutes to an hour and hopefully see and know that PrimePay will deliver some good content here for you today. Before we get started, let's go ahead and go over some of the logistics of our webinar here today. We have a lot of folks on the line here today, so what we've done is we've muted everybody's phones, okay? But that does not mean that we don't want to hear from you. That is completely opposite. We do want to hear from you. And if you would, if you have a question as I go through the content today, if you would go into the GoToMeeting menu bar, there's a question box. You can go ahead and type in your question. I've already had a couple people type in some questions already. Fantastic. If I have an opportunity to be able to answer the question, you know, here throughout my webinar today, I will absolutely try and do so. Many times, just due to the length and timing, I'm unable to specifically, or you might have a specific question that's really not a general question, but really specific to your own experience and issue. And so what we'll do is we absolutely will get back to you offline and get answers to your questions. So please feel free to go ahead and type in your question as I go along here today. One of the most popular questions, and I've already received it, is the question around the presentation. Is it being recorded, or can I get a copy of the slide deck? For some time now, we have been posting on our public broker concierge channel. We have been posting all the recordings of these webinars, and you can go to our YouTube channel, go under our broker concierge channel under YouTube to be able to view all of our 2016 webinars, but you also have the opportunity to be able to view, actually over the last several years, a lot of webinars that we now have published there. So please, as a follow-up email to you, we will provide you with that link, but you have the opportunity, you know, here after the webinar today to be able to go there to view those additional webinars. A secondary question is always around our slide deck presentation. Can we get a copy? What we've done is this: if you are a broker concierge partner, we will provide you with a copy of the presentation here today. We feel that as an exclusive BC partner of ours, we want to provide you with the most exclusive content. So we want to provide that deck that you can use or may use with your internal team to certainly, you know, for your clients as needed. And there will also be additional follow-up materials that we will provide that will be exclusive to our BC partners. Hang around here till the end and I'll provide you with those details. So that should take care, I think, of a lot of the logistics here for today. We're thrilled to have you. So here it is, November 2016. It is one of the busiest times of the year. I do not need to say that to you. I'm preaching to the choir. Employers are renewing their health plans and making major benefit offering decisions, right? You would tend to think, I think we'd all like to think, hey, we've done this before many times, right? Actually, every year during this renewal season, we would think that it would go smoothly and easily and it would just roll, right? The benefits would just kind of roll. The decisions would roll into the new year. But it doesn't work that way, does it? And oftentimes when the renewal comes in and more regulatory compliance issues are either introduced that need to be addressed, that increases financial stress, anxiety is quite prevalent, and it requires more hand-holding by you, more education by you, more comprehensive analysis for the employers. It also demands your experience. And most required, I would say, is your ideas. And so that's where our webinar is going to start off from here actually today. It's about ideas. strategies that can be introduced to alleviate that stress and anxiety, to ultimately fulfill the employer's wishes in making their benefit offering not only comprehensive to their workforce, but also ensuring that your recommended offering is creating efficiencies, controlling costs, and mitigating compliance issues on behalf of your client. That's showing real value. And that's the emphasis of our webinars month in and month out, to enable you with specific strategies, with specific answers to regulatory guidance that you can ultimately turn around right after this webinar and be able to go to your clients and drive real value, or whatever their perceived value needs to be that ultimately you're trying to address with them. So that kind of leads to our agenda here today. Let me see if my PowerPoint is working here. So I've got somebody working for me here, actually putting up our agenda here today, but our agenda here is focused on HRA strategies. As you know, HRAs, or actually, as you know, PrimePay has made a statement here over the last several months. We've tried to be very clear with this particular statement, that we believe here at PrimePay that every group health plan needs to be paired with a pre-tax benefit account. Now that can be an FSA, a flexible spending account. It could be a health savings account, type of a plan design, surely. But it also comes to a health reimbursement arrangement. And many of you are familiar with an HRA, but may not be as familiar with different strategies that could be overlaid an existing employer's plan, okay? And so we're going to talk today about two key strategies. One that I feel is becoming more and more popular. It's something that we have we addressed and announced, introduced probably 7-8 years ago, and there's been a very slow adoption rate up until now. And so we want to talk specific about utilizing a copay replacement HRA to your advantage, not just to your advantage, but it's an idea that you can ultimately bring to the employer and employees for savings and consistency. There's also a retiree HRA. There are many types of acquisition targets that you're going after, in the likes of municipalities to nonprofits to union shops to whatever it may be, to larger employer groups, where this concept is becoming more popular out there, where you need to understand kind of the regulatory guidance and the compliance issues, the challenges, the advantages that you can ascertain by utilizing or incorporating a retiree HRA strategy. Two key strategies today that I think will absolutely help reduce or curb those costs that we're feeling today. And then lastly, I'm going to highlight 7 key year-end deadlines. We're going to kind of rapid fire them, but I want to go through just 7 key year-end deadlines that, as you're speaking with your clients in the next, in the current month, certainly through the end of the year, that you're specifically addressing these 7 issues or 7 deadlines that they need to consider, whether it's impacting their employees directly or something that's just impacting them as an employer. Okay. So when you see this first slide here, you see this title, Healthcare Costs Rise by Most in 32 Years. I don't know, did you do what I did when I first saw it? Here it was shown here on CNN Money here just in September, so about 45 days ago. And let me tell you, this caught my eye. Because I'm sitting here going, okay, I know healthcare costs have been rising, and it's pretty strong, right now as far as that growth. But it's been the most in 32 years. So if it's intriguing to me, I'm feeling it's kind of intriguing to you. So healthcare costs rose sharply in August of 2016. So what this particular title is meaning or focused on is August of this year. So prices for medicine, doctor appointments, and health insurance, so health insurance premiums, rose the most in August since 1984. Medical care costs altogether rose 1% just in August from July, according to the Consumer Price Index. As many of you have known, and I've highlighted a lot from Kaiser over the last several months, just as they had introduced their annual report, their health plan report, very good report. I suggest everyone takes a look at it to see common statistics and metrics of where things are headed. But they have forecasted that the average family health care plan will cost $18,000 here in 2016, and that's up an additional 3.4% from 2015. That's faster than wage growth in America. And actually, that trend, as I've highlighted in other webinars, that trend has continued quite a bit. Now, the price increases come amid a much broader debate, right, about climbing healthcare costs, high premiums. It's been proliferated by the upcoming election, been stated time and time again here, and they've stated some common key issues. That premiums on the Obamacare exchanges are expected to rise nationally 25% on average. You've also seen headlines in regard to health insurers such as, Aetna, United Healthcare, and certainly many others. They've made announcements that would pull out of the Obamacare exchanges. And this is interesting. They say that they're pulling out because Obamacare patients have turned out to be sicker and costlier than expected. In the state of New Jersey, there are only now 2 carriers in the state of New Jersey, and we could go on and on in regard to the level of competition, of choice and flexibility that's now available in those exchanges. Now, premiums is one thing, right? Healthcare cost is a big deal. It's not just focused on premiums where sometimes we think more specific to an employer cost of providing benefits, but employees, individuals are also being affected. Overall, workers are paying more for deductibles. Over half of the U.S. workers with single coverage plans pay a deductible of $1,000 or more. That's up from 31% of workers just since 2011. So now it's over half of workers. And certainly healthcare price increases come as inflation overall continues to be low. Consumer prices altogether just rose 1.1% in August compared to a year ago. So I'm bringing this up to share with you. I know you know that healthcare costs are rising. I know that employers know that healthcare costs are rising. But I stated kind of in my opening kind of monologue in just the reference of you're dealing with employers thinking that you're going to go into the next renewal more easily. This year it's going to be different. We're going to move more swiftly and efficiently into that new year. But these healthcare costs certainly continue to get in the way and of that decision, causing that financial stress to the employer, also very much to the employee as well. So in this next slide, just again to lay a foundation for our strategies here today, I also want to highlight another chief contributor to this cost, which again you would say, Steve, I think we do know this, but it's high drug spending that has occurred. The annual growth rate for per person retail drug spending with coverage through a large employer, that's what this chart is representing, so employer-sponsored coverage, has been relatively low, really kind of fluctuating between 0% and 5% over just quite about a 10-year period. But it spiked in 2014, which is the most recent data here, of up to 13%. Now, a lot of analysis has been, identifying specialty drugs as the primary driver of this spending. So, as I say that, you guys may have anecdotal evidence of that as well in regard to your own experiences with your employers. But certainly specialty drugs, those for fighting cancers and hepatitis C, those are clearly being utilized more. Those utilization rates are increasing rapidly, which is ultimately increasing that cost. Another key metric that I also liked, at least in regard that I wanted to point out here for the webinar today as part of the high drug spending, is that when you look at retail prescription drug spending, it accounted for over 21% of employer-sponsored health spending in 2014, so represented 21% of the total. When you look at the overall national health spending during that same time period, which is on your left, it only accounted for 10%. So under employer-sponsored health spending, there is a greater utilization here of prescription drug spending. I highlighted in our webinar here either last month or the month prior that the Department of Labor has also stated that healthcare expenditures, so the individual healthcare expenditures, has now come only second to housing expenses. So housing expenses to an individual are number one, and healthcare expenditures are there now at number 2. So we have this issue, we have this opportunity, you have an opportunity to be able to talk about strategies that are curbing cost. Okay, and so we have to do a timeout here, all right? We can't necessarily, as a benefit consultant, as Steve Jackson here at PrimePay, or as a single employer, solve the issues of cost. I guess what it points to is that we've got issues here in America. Certainly didn't want to point that out for you today, but yeah, we have issues, but we can't single-handedly do it. But what we can do is look for ways to strategically, with ideas, be able to curb costs specifically for your employer groups, your clients. So what I've done here is actually I'm listing here a few strategies that I'm only doing a very high level here, but some key strategies that you use today to help control cost based on that renewal decision for your employer. Now, there are many of you that have such great ideas. The things that I'm going to show you today, you're going to go, hey, come on. I mean, there's way more than the others than these strategies, but there are, you guys come up with great ideas. So I'm listing kind of high-level ideas for you as we're thinking about just common strategies to curb costs. So the first one, right, selecting a new carrier, yeah, no-brainer. Hey, you know what? We got this, a 12%, 15% or more kind of increase with this carrier A. We are going to look at carriers B, C, and D, okay, and let's try to get quotes. So one of the easy, quick kind of ways to just, let's see if we can find a cheaper price would be to select a new carrier. You could ultimately just change the employer contribution, right? An employer might just say, hey, I've got a specific budget that I can spend this next year in 2017. So I'm going to look at that ultimate premium, and I might have to change that. I may have to increase, decrease, that specific contribution to meet my specific financial needs. Two very popular items is increasing deductibles and their coinsurance, or increasing copayments. By making that change, you can instantly see a various amount of discounts applied to your premiums, from a couple percentage points, 5% to over 20%, right? I mean, depending on the type of plan that you ultimately are going to choose. Other options that could be there could be to add additional RX tiers. One of our channel managers has stated that in one of the states, carriers have actually expanded their number of tiers available to over 7. Hey, let's not make it easy for an employee to understand how to fill their prescriptions. But why are they doing that? It's trying to control and curb those costs that I had mentioned. So adding additional RX tiers, not just increasing copays, but adding those tiers can certainly help reduce or curb those costs. Maybe it's just simply changing the plan design. You're from a richer plan design to something less rich. Maybe it's increasing the number of plans. Say, Steve, wait a minute. I mean, how is increasing the number of plans? Well, there's some strong metrics that show whether in an exchange environment, whether private or public, that as employees are given choices, that guess what options they're choosing? Well, hopefully, one, they're choosing the type of plan that's best for their family, but they're choosing a less costly plan. So maybe an ability for an employer to curb cost certainly is to increase the number of plan selections to their employees. Maybe another opportunity would be to move towards narrow networks, working with the carrier, with that network, and really trying to narrow that to ultimately lower those costs. Maybe an employer would choose to only now cover, instead of whole family coverage, employee spouse independence, I'm going to try to curb costs by only covering the employee independence. Clearly that falls within the ACA, the employer mandate for offering coverage, and so there's no penalties that would occur, but that could enable that employer to lower cost even more. Second to last, there's self-funding. You might finally be sitting in front of that employer where the timing is just right. You know what? We need to consider some additional self-funding types of options to help reduce your overall cost, and be able to go through that analysis to determine whether that's the best fit for that employer. But certainly is a great strategy to be able to reduce some costs. Not for everyone, but it can be for many. Or, and lastly, and you don't want to hear it, I don't want to hear it here as Steve Jackson from PrimePay, but that employer may decide, you know what, I'm done. I'm through with that. I'm getting out of being the provider of health insurance for my employees. Now, there comes with that a lot of intended and unintended consequences, and that's probably not the right scenario. But an employer as a last resort might clearly consider that as an option. So it is in your role as a benefit consultant to certainly discuss these strategies. And again, I went very high level. There's probably many others that you could dig deeper into that can drive a significant strategy to curb an employer's costs. But I think as you look at that, you say, Steve, yeah, that's a good, solid list. So those are one of the ways from a health plan that you can drive costs lower. But we have two significant developments in this conundrum, right? We have an employer's side of the strategy, and we also have an employee's side of the strategy. Because the employer needs to ultimately drive a benefit that is going to be conducive for them as an employer. You know, financially, it's providing the right type of benefits. I need to attract and retain my quality employees, so I need to provide that comprehensive benefit. But they also need to evaluate their workforce. What's best for our workforce? What can they afford? What is best for them from a network basis, and so forth. And so today I want to talk about that additional component, right? So as I made that statement, you know, every group health plan needs to be paired with a pre-tax benefit account, and HRA strategy is going to really fit into that mindset. And so the first strategy that we want to certainly bring to your attention today is specific to the copay replacement strategy. And so there's aspects to this strategy, yes, to control cost, but there's also a process flow, right, in how the employee is going to manage this responsibility, how an employer is going to manage it, how are they going to be able to get the data from it, you know, to see that utilization and so forth. So ultimately, yes, this strategy is to reduce the financial burden on the employer and the employee. But two words really come to mind with this strategy: savings and consistency. All right. So we're going to dive right into an example of this strategy, okay? And I've been careful here not to be specific to any one carrier or specific plan, okay? Here's the big idea, right? The idea that you can bring to your employer. And I know many of you understand the concept here of copay replacement, but let's just build a foundation here so that everyone is clear. Under the copay replacement HRA plan design, we're looking specifically at the co-payments of the current existing plan from that employer, what the employer is currently providing. And what this employer is trying to do and seek is they're trying to find savings, they're trying to find cost reduction, whether it be from a premium, you know, overall, at least where you're going to see the greatest savings is in the premium discounts that could be received from this. But we also want to enable an employee to be able, so that it's simplified and streamlined, we want the employee to be able to get through this process in an easy way, in an affordable way for that employee as well. So some examples. So I'm just going to kind of go top to bottom. We'll go through this pretty quick, and then I'll show you a chart here that we can go a little deeper in to show it all on one page. So I'm going to just go through some copays here. We have imaging copays, right? You've got basic imaging, and you also have advanced imaging type of copayments. And let's just say with the plan on the left, their current medical plan, basic imaging had a copay of $20. On the new medical plan that they would look to renew into, the basic imaging copay would be $40. Next is advanced imaging. Certainly it's kind of covering those, you know, MRIs, I mean, certainly those more advanced type of imaging needs. That copayment was at $100. It's now on the new plan, $250 copayment. Outpatient surgery, there's a ton of that going on, certainly across the employee demographic space. That copay was at $100. It's now at $250, okay? I'm just going to move on to the next page here. So the next copayment is urgent care. Boy, utilization, heavy utilization there. You're seeing these copays increase actually a whole lot more, right? I mean, as you see that here today. Urgent care under the current medical plan is $50. That's what the employees are accustomed to. Now with the new plan, it would be $100. Through your primary care physician, your specialist, the copays of $20 and $40, that now would go under the new medical plan of $30 to $50. Then prescription, right? I showed you that key metric that over 21% of that employer-sponsored healthcare spend is from RX alone. So RX, very important in this process. So the current copayment for RX, $10, $25, $50, and you notice here now to the right, under the new medical plan, copays have increased, but we now have added a fourth tier, okay, of $150, okay? So as we look at this, as we go kind of to the first kind of dialogue and strategy, part of the strategy that we're trying to realize as a result of this move is first, savings to the employee, right? So we're looking for savings, we're looking for consistency. So we have under the current plan, and let me just get my spotlight here. So under this column, you have the current plan. We have all the existing copay structure. The new plan, okay, is listed here just next to it, to the right. That's what the new absolute copays would be. That would be due to that provider based on claims that would be incurred. However, what would be the employee share for establishing an HRA co-replacement strategy? What does this look like? Well, the employee share is going to remain, generally speaking, here at the existing current plan levels. So 20, 100, 150, 20, 40, those are all staying the same. So even though we have increased that copay amount, we have actually kept consistency in savings to that employee. Now you notice I changed it up here a little bit, and again, with an HRA, because of the flexibility in design, I'm kind of showing you many different copays. I mean, your employers may want to pick and choose. Maybe they only want to focus on RX because that's a key item for their plan and for their workforce. But maybe you want to start seeing outpatient surgery utilization or urgent care utilization. I'm showing you here in this example just where all of these copays are being reimbursed by the employer through an HRA strategy. But specific to the RX, you notice here I put it in bold, reflecting that for the generic tier that the employer is going to reimburse 100% of that new copay, which would be $20. Okay, so for an employee, they're now encouraged, certainly, to go after the generic types of filling that prescription, generic prescriptions, but also now we'll get that as a free value to them. And then the employee is only paying basically the same financial amount overall for the other tiers. So as we look at kind of the employee savings variance, right, with this particular plan design, the employee is actually having really maximum savings. They're basically paying exactly what they had paid before. They're not seeing that change. And actually, though, in the prescriptions, they are seeing a change, okay, in that. All right, as we go now to employer, as we go to the savings for the employer, you notice here now that from an employer share perspective, because I'm showing you here the current plan, the new plan, so that's all the same as far as what I showed before, as far as what the carrier, what the plan is actually going to be charging for those events. The employer share here now is worth $20 for basic imaging, $150 for advanced imaging, $150 for outpatient, $50 for urgent care, and so on and so forth, 10 and 10 for primary care physician and specialist. So as you look at this, though, we look at utilization. One nice thing about HRAs is that over time you're going to see a clear utilization rate and pattern based on these specific types of co-payments that are generated. You know, what's really the utilization that's going to be shown here for basic or advanced imaging? I mean, it's not going to be a lot, you know, of your employees. Outpatient, how many of these would be reimbursed in a given year? You know, even urgent care. With preventative care being covered at 100%, this 10 and 10 may not even be shown at all unless someone is truly sick, you know, and they're seeing the doctors, providers outside of their preventative care visits. Prescription is where you're going to see that utilization. And again, this plan design would enable the employer to be flexible enough to really drive this specific copay amount that would best fit their workforce and their needs. Ultimately, what the employer is seeing at the end of the day with this strategy is the premium savings by moving from the current copay plan here on the left to the new copay plan. Now, I'm not here to say what that specific discount would be. Depending on the type of prescription tiers, the level of copay amount that you move to is ultimately going to dictate, right? where that premium discount is ultimately going to be. So I'll leave that to you and your specific analysis as you go through the underwriting process. So as we focus on savings and consistency, I just want to kind of showcase two areas. You know, so what does this market look like here for you? And also just results. What's the result of this decision to move in this direction? So the market really, I mean, an HRA, do know that an HRA can be established for any employer of any size, okay, to be quite honest. An HRA is so flexible to be used with small group, large group, self-funded, fully insured. You can establish an HRA with any employer size. However, with this, so that you have maybe more control, or underwriting has more control over the development of your plan and the discounts that could be provided, these generally could be for larger groups. You know, certainly those that are underwritten, possibly more of those 100 plus. For those of you that are seeking going up market for larger groups, this strategy could be a wonderful strategy that you're introducing to that group so that you could win that business. It's also going to be seen, though, quite a bit in those I'll say, industries or organizations such as municipalities that, you know what, they have a tough time every year changing their specific health plan, right? Maybe it's a union shop, you know, you're in the middle of a CBA discussion, and if any of you have been a part of those discussions, what are they fighting for? No change. You know, they want no change in their health plan, no change in their contributions, deductions that are being made. They do not want to see any increase. And yet those union shops or those municipalities are faced with budget constraints. They have to try to control it in some form or fashion. And so a copay replacement strategy utilizing an HRA can be very valuable in these instances, in these markets, in these specific situations, to enable a municipality or a union shop to be able to reduce or keep costs constant while not providing that cost increase ultimately to that employee is a really big deal. And the last one that I list here is a nonprofit group. Clearly, for most nonprofits, they provide rich benefits. Why rich benefits? Because they can't afford the compensation, the salary side or that component. So they may not pay them as much in wages, but their benefits tend to be a little more rich. But they struggle with raising funds, having enough money to be able to do what is needed. And so these cost increases from year to year are really truly a major killer and a major decision point of anxiety, you know, each and every year. So a copay replacement strategy utilizing an HRA could be very strong in helping a nonprofit group get through their specific renewal, this year. The results, you know, some key features, benefits, results of utilizing this strategy. One, you get a lot of flexibility. The HRA can morph and evolve or transition into whatever is needed for the employer. And that gives you flexibility to consult, advise, provide analysis on many different types of plan designs and to see where that HRA could be a great fit. The main, a main keyword, as I've used here before, is consistency. This allows extreme consistency in a plan level design, okay, where from an employee perspective, we have consistency in cost, generally, and activity there. But from an employer, it gives them the ability to maintain consistency, but also have that reduction in cost very prevalent. It is 100% deductible, so HRA reimbursements are 100% deductible by the employer, 100% tax-free by the employee. And one of the key areas is certainly utilization, being transparent, having the accessibility to those metrics, to those utilization numbers. So clear utilization is achieved. I mean, wouldn't most of your employers want to know, to have at their disposal and readiness, a report that is generated saying how much was spent on the outpatient surgery, how much was spent on advanced imaging, where did it come in here in regard to the tiers of RX, where is the money being spent, right? That's going to help you provide consultation advice as you go into the next year. Those are great metrics. And lastly here is just the premium savings. With this enables, realization of employer savings by moving to that higher copay type of plan. Now, when we talk about service or savings and consistency, we also need to think with the employee in mind, because as you develop a strategy such as this for your employer, which ultimately will be consumed by the employees, we need to make sure that these strategies it's easy, it's efficient. We need to simplify, we need to streamline the particular processes. And so I just want to cover a couple ways certainly that you can use efficiency, technology to be able to streamline this particular strategy with the employees, because you need to understand how you can utilize these. So the first I show, right, for the best practice when you utilize an HRA, the item that honestly removes all confusion from an administrator or someone who is a third-party administrator managing the claims processing for HRAs, an explanation of benefit statement is priceless. It removes all confusion. When you think about a copay replacement strategy with an HRA, it does not mean that they don't have a deductible. They could have coinsurance. There could be out-of-network claims. There could be a lot of other things. And so there could be a need to have an EOB, an explanation of benefit statement kind of submission process that's needed, okay? That's a fail-safe. That's a best practice. But is that really the most efficient way for an employee to be able to work within this copay replacement strategy environment? One of the great pieces of technology that has really come into fruition, and it's only improved over the last decade, has been the use of debit cards as it relates to pre-tax benefit accounts. Debit cards were first introduced really at the start of this century, basically around that 2002 to 2004 period is really where you started to see debit cards being utilized. And so think of it like this. Think about a flexible spending plan. The debit card only allows for purchases associated with providers that sell medical types of expenses, qualified medical expenses. And so for years, the debit card has been tied in this type of a strategy directly to merchant codes. So as you see there to the right, you see that you have several different merchant types. And if we just go down the list, you've got record shops that have a merchant code of 5735, so on and so forth, okay? So what's nice about a copay replacement strategy is that you have the ability to tie the debit card activity to separate merchant codes. You say, why would you do that? Because an HRA generally is designed by the employer, for the employer and its employees, but the employer only wants to reimburse specific types of activity, specific types of expenses. And so what you need to know as you're talking it over with your employers, you need to understand where the debit card technology can go. so that it could be assistance. That way you're not creating a copay replacement strategy that is just going to be off kilter and we can't do, or the technology cannot provide. So there are separate merchant codes for the PC, for your primary care physicians, for your specialists. That's the same code. Okay, can't differentiate between that. It's one code for the PCP and specialist. There's one merchant code for the emergency room. There's one code for urgent care. There's one code for prescriptions. Okay, so I just list 4 there. But there are specific merchant codes, and when you utilize a copay replacement strategy and use the debit card, it then enables you to establish separate reimbursement levels for each code. And so if an employee was at the pharmacy, an employer could establish a fixed type of reimbursement or a percentage split type of reimbursement, okay? And so what this also allows for is then if the employer has also adopted an FSA and that employee has elected their health FSA, they, in one swipe, in one transaction at that specific merchant code, they could actually split amounts into the FSA and or for the HRA. So as an example, in a percentage split scenario, let's say you established a copay replacement strategy where the employer is reimbursing 80% of all RX copays, 80%. The employee has elected their health FSA and they have money available. Well, when that employee goes to the pharmacy and they are about to pay, or they are now paying their $100 copay for that specific prescription, $80 will come out of the HRA to be reimbursed there, and then $20 will come out of the health FSA for that employee, all in one all in one transaction. So that is the power of the merchant codes. And you can work with our channel managers, our team, to be able to really define those more. But this gives you at least a good picture as far as what that technology can provide. As you talk with this strategy, it'll be important for you to truly streamline and simplify this process. And while the manual submission process is always there, you want to know how the debit card technology can work to really take it to another level. I now want to talk about our last strategy, and this will go just a little quicker, certainly, to discuss. But this provides a means for employers to truly think beyond the active employee. Many of you might be going upmarket for larger employers, and a retiree strategy is being used more and more and more, not just with unions, not just with municipalities, but it's with larger employees as well. The focus of a retiree HRA benefit is not necessarily what that benefit means at retirement, when that employee actually retires. It's the cost savings, it's the strategies that are existing prior to that individual or that employee becoming retired. So that's why I say it's kind of thinking beyond the active employee. And as you see this screen kind of develop here on your slides, you see different words here: innovation, ideas, you see projects, solutions, right? Creation. This is where you can get a little creative, I think, and add additional value to your clients, larger employers, where you can permit those valuable former employees, which are now retirees, to be reimbursed tax-free for maybe individual medical premiums and other qualified medical expenses, right? So this is pretty powerful. But first, if you're going to introduce a retiree HRA strategy, you are going to need to consider the regulatory compliance, or I'll put it as more of the guidance that you need to establish this correctly. For an employer establishing an HRA, they're going to be looking to try to find ways to curb their cost, right? Employers will look at an HRA to do that. They're going to try to define the HRA in a way that can save them money today and certainly in the future. Well, a retiree, an individual who is employed at HRA benefit from year to year from that employer. Under an HRA plan design, the employer then could stipulate that any funds that are unused would not be forfeited. No, it would actually be rolled over or carried over into their defined retirement. So when that employee has fit the definition of a retiree for that employer, they would then receive this additional benefit into retirement. So let's understand, as the Affordable Care Act has now introduced additional requirements, right? We now understand more than ever what accepted benefits or non-accepted benefits, what that means. So you need to understand what an accepted benefit. We need to keep this under the guise of an accepted benefit. So let's look at the guidance here very quickly. So this was first mentioned in IRS Notice 2013-54. So back in September of 2013, the IRS was needing to provide additional details in regard to how an HRA may be used by an employer as a strategy, but ensure that it does conform to the ACA requirements, the specific mandated requirements of plans, of group health plans. So they first came out and stated that HRAs could be used for retirees, but it was a very small portion of the overall notice. And so they did need to provide some additional guidance, and they did come out and actually confirm it at the very end of last year under Notice 2015-87. And they basically have stated that if you are offering an HRA benefit to fewer than 2 participants, in this case a retiree, that it would be considered an accepted benefit and it would not need to be integrated with an employer-sponsored group medical plan. Okay, and so a retiree HRA then would be free to reimburse individual medical premiums and other qualified medical expenses. It's practically the only way in order to do that, okay, to be able to reimburse individual medical premiums in this fashion. So just some key considerations. Part of the Affordable Care Act has been to confirm different types of benefit offerings on whether they are considered group health plans, whether they need to comply under the various mandates. And so do know that what was causing a lot of confusion is that, or additional focus on the mandates, is that the HRA was considered a group health plan. It is providing minimum essential coverage. So just like a standard ACA compliant plan where there should be no annual limits, there should be no out-of-pocket costs for preventative care expenses, all of those types of mandates, that the HRA would need to comply as long as they are integrated, or actually, they would comply if they're integrated with a employer-sponsored group health plan. But outside of that, we have issues. So a retiree, now that a retiree HRA is considered an accepted benefit, and so we're good to be able to offer that, what you do need to understand is that a retiree that has this HRA, that they are not eligible for a premium tax credit as long as they're covered by the HRA. So what an employer needs to do is create an opt-out provision, or at least a suspension of that HRA, to permit the retiree to qualify for that premium tax credit. This could also, though, be some additional savings that an employer could realize. Maybe the employee, the advantage of them would be to qualify and receive that subsidy, so they're going to waive or opt out of that HRA. Again, that's additional savings that employer might realize from that. In regards to the regulatory compliance, that's really it, okay? So there's not any additional significant added guidance or compliance issues that you would need to understand. So, but in the language of the HRA, you would need to create an opt-out provision for the retirees. So savings beyond employment, we're going to look at employer and employee. So with this particular plan design, the employer is first looking at installing an HRA, right, for design flexibility. They want to create a type of plan that's going to fit their specific need, not just for active and current employees, but also for their former or retired employees there as well. So they want design flexibility so that it's focused on just maybe reimbursing premiums only, individual premiums only, or maybe just all qualified medical expenses, or maybe it's only dental and vision, right? So an employer can really define that HRA to reimburse what they feel is best, not just for them, but certainly for the employee's needs as well. So great design flexibility. Where the real premium savings can occur, it's going to be while they're an active employee. Maybe they've designed plans that has a higher deductible, that has more in coinsurance, some of those things that I talked about here earlier that actively enabled a heavier discounted premium. And so their savings are really occurring, those financial deep savings are occurring while they're an active employee. The HRA is accumulating. You know, it's building, or it may be staying stagnant, but it's available so that once they become a retiree, they now can use that. So it enables them to control or cap that retiree spend, which I think is very important from an employer basis. Because too, some employers might have a retirement plan, have retirees that are on their group plan, right? But to control or cap that retiree spend even more, utilizing an HRA for that is going to be very, very valuable. And clearly 100% deductibility of it is very important. From an employee basis, you know, clearly a huge benefit for that retiree. 100% employer funded. Beautiful, you know, from an employee basis. It's tax-free. I don't have to worry about, when I get reimbursed, I don't have to worry about actually paying taxes on this. It also enables, there's kind of a nice feeling from a retiree as you're an active employee, if you're able to kind of build up maybe some medical savings within this HRA over time, that is a wonderful benefit. So that's a feel good to know that, hey, I might have my premiums taken care of, or dental or vision expenses taken care of. That's huge. And that it might also cover not just me as an individual retiree, but also my spouse, you know, or family that I might have. And also, too, the choice. That is a good thing. They're not just tied to the HRA benefit. They have a choice between that HRA spend and what they may be able to qualify for under the premium tax credit, that subsidy eligibility, which could be, again, if opting out of the HRA, could be that additional savings that the employer may realize. So two key strategies that I hope, as I went through them here today, really focusing on savings, on consistency, but also streamlining and simplifying this activity for the employees is very, very important. And it's the big ideas, as I mentioned, right? Strategies that you can take with them to hopefully ease that anxiety and stress level that they're probably feeling right about now. So I hope that this content was actually very good in providing you information about those specific strategies here today. Lastly here, and again, I told you I would probably try to rapid fire them here to some degree. I want to cover just seven kind of key deadlines or key activities that your employers are going to want to really drive here at the between now and through the end of the year. Okay, so I would ask, you know, PrimePay, we get involved quite a bit in ERISA wrap documents, compliance documents, also Section 125 plan, Section 105 plan documentation. Time and time again, we recognize that what might be listed on an insurance certificate of coverage as far as waiting periods, eligibility, plan design, whatever it may be, is vastly or maybe certainly different than what is listed in the documents. And what I'm just asking, or what you should be asking your clients to do, is take the time and review your plan documents. One of the easiest things that seems to change from plan document to plan document is that the employer is listing different waiting periods, different eligibility periods for the benefit. That shouldn't be happening. We've also come across some employers that have plan documents that they are reimbursing individual medical plans here today, not in a retiree HRA, but they are they are offering that today. You need to talk with them, review existing plan documents, and ensure that that specific employer payment plan, which is this HRA, would not be in place, okay? Second, analyze your tax-favored arrangements, HRAs, FSAs, certainly HSAs. So a couple things. You want to ensure that the HRA, that the strategy, the design that they have established, that does fall under the accepted benefit rule. So it either needs to be integrated with the group health plan of that employer. It must either be integrated with other group health plan coverage, but that's other ACA type of coverage, so still a group health plan that it needs to be integrated with, or it needs to fall under one of the other accepted benefit rules. So one, the retiree HRA, maybe it's a dental, vision only type of a plan, so forth. Health FSAs. Health FSAs are, health FSAs, do note that the limit has changed. They have increased the health FSA limit for 2017 plan years. That limit has now gone to $2,600. Lastly, on HSAs, as you're analyzing your tax-favored arrangements and documents, when an employer adopts an HSA and is starting to permit employees contribute to their HSAs with pre-tax dollars, that language needs to be incorporated within those plan documents. So please make sure that is being done. Notice of plan changes, I would just say talk with your employers each and every year at this time that as they make those changes, be sure to make those corresponding changes within their appropriate notices like SBCs, any summaries of material modifications that would occur due to ERISA. Maybe there are different language that needs to be added because you now are allowing for mid-year changes and salary reduction elections, in the event of an employee's enrollment in health insurance marketplace coverage or other things. So make sure that you're actually managing that as well as you are able. ACA reporting, clearly, just so that you know, one of our key deadlines for clients that will be signing up for PrimePay for the ACA reporting deadlines, our new sign-up deadline for the 2016 return year is November 30th of this year. So it's coming up, end of the month. January 31st, of course, is the distribution deadline of Forms 1095, and then the e-filing deadline is March 31st of next year. The last three items that I'm showing is just keep in mind for groups that have 250 or more W-2s, they are required to report the cost of employer-sponsored coverage on their W-2s. So make sure that is actually being done. Okay. Next is non-discrimination annual testing. There is a specific annual non-discrimination testing requirement for HRAs for all Section 105 plans, and also all the testing that's needed for your cafeteria plans, your FSAs, your premium-only plans. Ensure that your employers, they need to pass that test by the end of the plan year. If they wait too long, they're going to miss the opportunity, if they were to fail the test, to make any necessary corrections. So remind them, have you done your test for this year? And lastly here is the transitional reinsurance program. Reinsurance fee, as you know, it's collecting contributions from employers that sponsor certain self-insured plans that provide major medical coverage. And if the employer is choosing to do one payment, they need to do so by January 17th of next year, and that will be at $27 per covered life. If they choose to do it in two payments, the first is due by January 17th at $21.60 per covered life, and the last one is due by November 15th, which represents it at $5.40 per covered life. So hopefully that is very good information for you. You could just take this slide and just make sure that you're actually in an email, or as you're sitting with the client, make sure you're going through these key 7 items with your employers here over the next 30 to 60 days. All right, I do want to, as we're wrapping up the webinar here today, I do want to just kind of bring to your attention our special offer. PrimePay is actually, for the first time, this is our most aggressive offer that we have made in regard to our FSA and HRA administration and solutions. So in the spirit that PrimePay believes that every group health plan should be paired with a pre-tax benefit account, we are putting our money where our mouth is, where our statement is. And so as you can see here, our year-end promotion that is going on right now through plans that are starting through January of 2017, there is no setup fee, no renewal, no monthly minimum fee, only a low PEPM of $5.50 per participating employee per month. Not a bad offer, all right? So check into that. We'd love to be able to propose at least those services to your clients here as we enter into this new year. All right. So the last item here is just for wrap up. And we do want to thank you for attending today. I actually just want to say thank you for the business that you have provided to PrimePay, what you've referred to PrimePay in 2016. We value not only all of our broker partners, but certainly our broker concierge partners who have absolutely committed to work with PrimePay here in 2016, and we are committed to continue to work with you to provide the highest quality and service as we can here as we head into 2017, and we look forward to working with you here into the new year. As follow-up for our webinar here today, just look for a couple materials. We will be sending out the link to the recording. We also will provide what I showed you here today, our special year-end promotion on our FSAs and HRAs, so you'll get that flyer. And exclusive for our BC partners, we're going to give you just a little more. So you will receive that presentation slide deck, so get a copy and you'll be able to view that at your leisure. We're going to provide a HRA cost savings analysis worksheet that you can sit there right in front of your employer and work through actually a cost savings analysis for them based on a copayment plan or a deductible replacement plan, whatever you may be looking. And then we actually have, I believe it's 3 additional HRA specific briefs that will enable you to just support your business even more in this area. Folks, I appreciate your attendance today. Thank you for joining us. I want to wish you the most wonderful holidays that are coming. Happy Thanksgiving, and certainly additional holidays that are coming quickly, right, to us all. So that will conclude our webinar today, and we look forward to actually seeing and hearing from you in our next webinar here in the coming future. All right, take care and have a great day.